Welcome, everyone, and thank you for joining us. It's my pleasure today to welcome Ron Ropp, who is the Chief Technology and Security Officer at HealthITq. Ron, it's great to see you again.
Thank you for having me.
Absolutely. So we're going to dive in. There's a lot to talk about here, and we want to see how far we can get. Let's start at 40,000 feet up and then drill down and, quantities of 5,000 feet. How's that? So let's start by talking about what do you see from your standpoint, and you talk to people nationwide all the time. What are the biggest challenges right now facing health systems today with regard to cybersecurity?
Well, as you know, you're in this topic all the time yourself. They're numerous, but I think if we start at the top, it usually has to do with money and resources and staffing and making sure that fits. But if we drill down into that a little bit, threat detection and response maturity is a big issue. Most systems today at least have something in place to address cybersecurity from a detection standpoint, but maybe not be as mature as what to do with it when they do detect something bad that happens.
Can I interrupt you right there and ask you to clarify for us and amplify a little bit? What does response maturity mean? I know what it means on a superficial level, but you might be able to enlighten us a little bit.
Sure. So if an alert comes through to the help desk that something strange happened, or a system that they put in place like a SIEM, a security incident event manager type of software solution, detects something, what do we do with it after that? And how do we rally up the security apparatus within the organization from a process standpoint to then respond to it appropriately? Is it a false positive? Do we need to actually take additional action and stand up a response team? Or what do we need to do with it? So the instrumentation of threats as they get detected, which almost happens every day, a lot of times the process on the tail end of that is not ready.
Exactly. And continue. What are the other biggest challenges?
So executive targeting, whaling is sometimes you'll hear it called when emails and targeted attacks are sent to executives. It happens all the time. And a lot of times we don't hear about it. Sometimes executives will get a text message that seems odd or an email that seems strange, and they just kind of ignore it. Or maybe a week later they go, "Hey, this came in. What do you think I should do about that?" And training the organization and executives specifically that how big of a target they really are from a financials perspective.
Yeah, absolutely. And if I can interrupt you there too, Ron, we hear so many stories. I'm sure you hear many, many more. One of the things that keeps happening in organizations, even though people are being trained on phishing and all these other things, they get these emails. Someone has infiltrated the organization. And so they get an email that says it's from, your CFO, Joe Smith, right? And it says, and it's to someone who has some capability of moving money around, right? So, please make sure to put $20,000 into this account. And you think, well, that's a little odd, right? Obviously it's not, it turns out not to be from Joe, and it was the money. How far along are organizations really in terms of really training people to understand what's going on?
It's like going to the gym. You can't stop working out because the threats change and the sophistication of even the emails and the methods of doing that changes. And it's a nonstop thing. We see different vectors all the time as it relates to that with executives and staff, and mostly line staffers that, again, as you said, receive an email from the CFO that says, "Move this to this vendor today. I'm in a meeting. I can't talk to you about it right now. Please do it immediately and let me know when it's done." And having the institutional processes in place to have that person be able to go, "Wait a minute. Yes, you're my boss, but no, we have a process and we're not following that. I need to go check this."
Absolutely. And continue with the other.
Sure. So vendor partners, this kind of dovetails on some of those things too. So vendor partners are also another challenge because not having a unified way to handle vendor partners as they come into the organization, a lot of times through areas outside of cyber, and if cyber and InfoSec is not involved along the way, and getting those vendors onboarded and making sure that we understand what we're sharing with them and how we're doing business with them as part of a kind of a inculcated thing within the organization that vendors all of a sudden are plugged into the organization and doing things that maybe we had no idea about. Whether it be radiology or lab or other vendor partners that end up getting tied in. And it ties into the next problem to that, which is interoperability. So complex systems that get tied together that are not well understood, and a lot of times, and vendors' jobs are usually to make our lives easier and to help make it easy to get onboarded with them and to do work with them in an automated way. Without some good review, can end up leading to weak links with things that maybe haven't been completely vetted, that people just aren't aware of. It's not sometimes even on purpose. It's just, we integrated this, and then you find out after the fact that maybe we should have looked a little closer at it.
Yeah. I mean, healthcare is so odd, right? Like, we're all so involved in certain things and yet not involved. It's a weird contradiction. Speaking of involved and not involved, let's talk about physicians and nurses.
Yes.
This is such a tough one. They're people who are the absolute fulcrum people of healthcare, right? Like, you can't do with healthcare without physicians, nurses, and other clinicians. They're also among the nurses, certainly are the most interrupted people. And physicians often have credentials in multiple organizations, and they're working with 20 passwords and cursing most of the day. And so what should people think about with regard to how we make this all work, right? We need to enhance our data and cybersecurity. Everyone agrees in theory on that. But then it hits this conflicting value, which is trying to ease the challenges of physicians, nurses, and other clinicians. What say you?
Well, yeah, I mean, they're the reason we're here, right? And I've had docs tell me, straight up, I didn't go to school 12 years to learn your computer system. I came here to practice medicine, and they're right. And the technology adoption, I think the key, and it's gotten a lot better just in the last few years, but the vendors and the solutions adopting to clinical workflows rather than the other way around, so that if we can figure out how to integrate a system that doesn't require 12 different passwords and doesn't require 13 different programs, and that does give them I hate to use the term single pane of glass because it gets overused, but a way to be able to get a whole view of what they're trying to get to without having to go through multiple steps. I mean, speed is key. They count the number of clicks that it takes to get to something, and if they can find a shorter way to do it, they will do it. And security awareness around that, again, a lot of times it's secondary to them, and especially new docs and residents that are adopting faster than institutions are ready for. We see this all the time, especially with younger docs. I give me 30 seconds. I'm going to quick divest over to a story that I had with my son. He got a new doctor about a month ago, very young doctor, 32 years old. I say very young because I don't know when doctors started getting younger than me, but it's happened. And he was a very young doc, and he got on with a remote telehealth session with the doc for an initial consult. And about a minute into the session with the physician, they were having trouble getting connected, and it was disconnecting, and he was having issues with the hospital provided system. And the physician immediately said, "Hey, do you have an iPhone? Let's FaceTime." He hung up and FaceTimed with my son immediately right after that, and had their teleconsult on his iPhone. And that, again, was well intended, but maybe that wasn't the best way to go about it. And remote work is the last challenge, right? And I know that you know this, and maybe it's a separate topic that's going to come up, but remote work, that genie's out of the bottle. That's not going to go back in at this point. We all who are not frontline providers, almost all of us are remote working now, and getting that infrastructure around that to support the docs and nurses so that they can work the same, whether they're inside the four walls or outside of the four walls, is super important.
Yeah, absolutely. So let's talk about the cloud.
Yes.
I'm just so tempted to say I've looked at clouds from both sides now. I'm sorry. I can't help myself. But what impact has cloud adoption had on cybersecurity? This was the thing that kept many CIOs from adopting the cloud, and even now some are a little bit scared.
Yeah. I mean, the vendors have adopted faster than healthcare, and almost in a lot of verticals. There's other verticals that have the same problem, but the vendors have adopted so quickly because you can scale out, in an Amazon Web Services or an Azure or a Google Compute really fast, build up something that can scale to multiple healthcare entities and push it out quickly. Healthcare has been traditionally pretty conservative as it relates to technology, especially cloud adoption. A lot of times it's because of the legacy systems that can't interop with the more modern, whether it be multi-factor authentication and federated identities and the things that you need to help make it seamless to work, whether you're on site or remote. And I think the vendors have moved faster than the healthcare entities and even the staff, and just lack of understanding and capability within their organizations to make that pivot from the traditional on-site client server technology and software installed on computers to suddenly a kind of web first, cloud first infrastructure. The last piece, which some people like, is the financial spend models changed pretty significantly as well, versus moving from a CapEx, capital expenditure model, to an OpEx model. And in some cases, it's viewed very beneficial to folks. In other cases, they don't want to change that from CapEx to OpEx. So I think those are the biggest things.
Yeah, very important. Thank you. Okay. One consultant who I respect tremendously always puts things very simply. The bad guys are getting badder, and it's hard to keep up, right? We have all these threats. Now we have potential nation state threats against healthcare. Certainly, it feels as though the cyber criminals really are always one step ahead. How can leaders of patient care organizations evolve forward with the ongoing evolving threat landscape?
Yeah, it's tough because the bad guys can move faster than most healthcare entities can, and they're much more distributed and mobile, and can stay one step ahead of it. The model changed a few years ago from the trust but verify to the don't trust and verify. So the assumed a breach kind of model that started to come around. But maturity of the organizations to be able to keep themselves in sync with each other from the compliance versus cyber silos of activities, because there's one thing from a compliance standpoint to work with something, it's another thing from a cyber standpoint, and making sure that folks like HIM and the HIPAA folks are in sync with the cybersecurity folks, and understanding what's really needed. And since the threats are evolving so fast, the protection's got to continue to evolve, and that ends up continuing to be a kind of a push-pull for finance to continually see the cyber budget increase every year. And why is it increasing? We just bought this thing last year, but it's not the thing that's going to protect us this year. And being able to keep in front of the execs and the board members so that they understand why that's the case, and that it's kind of a cost of doing business at this point. Otherwise, you're going to be in the news.
Yeah, absolutely. Let me ask it this way. How can CIOs, CTOs, and CISOs really make the leap? How can they make their organizations safer? What are a few of the key strategies that you would strongly recommend? Again, I know you talk to people nationwide all the time.
Yeah, I mean, again, seat at the table, keeping in front of it, education. I mean, you have to have an audience to be able to educate. If you can, I've been in situations where I've been able to get in front of the board and have a 20-minute every month to be able to talk to them about, here's what's going on, here's a quick news snippet, and here are the things we're doing to stay in front of it, and here are the things you should be anticipating that's coming for you to review and approve and discuss, so that we can all stay ahead of it, or at least stay up with it, so we know what those risks are. The one thing that's helped to drive some of this, to be honest, is the insurance providers have gotten a lot more stringent with their requirements. And if I can't get insurance, that's a problem. So they've helped, believe it or not, in this case, to help push that along for some of the more sophisticated things that you need to have in place. And I think that that's real important. And then from a budgeting standpoint, making sure that it's one budget, not silos of budgets. You have that a lot with, radiology and lab and other departments that might have their own kind of discrete big dollar items that need to get done, but that there's other protections that need to move along with them that sometimes don't get included.
Absolutely. So, Ron, how do you see this overall landscape evolving forward over the next few years? If we were to have this conversation 3 years from now, say when I have even less hair, well, I have no hair, so I'll still look the same, less hair than now. But if we were to have this conversation a few years from now, what would we be talking about?
Well, I think, you know, and I've been saying this for the last couple of years now, but I think more and more healthcare needs to get out of the data center business. And I think it's really going to be moving to a distributed architecture, and it's going to be the other way around versus, and we're almost, I mean, we're well over halfway there at this point, but that it's going to be a cloud first, everything on site second. And right now there's still a lot of legacy systems that are out there that have not made that transition, that are big CapEx items that are sitting there that run the institution. And, you know, rad lab facilities, pharmacy, those kinds of things that have a big on-site presence. I think we're going to, that again, remote work and data center as a service, or getting out of the data center business in healthcare, I think are the things that are going to be the biggest things. And then, you know, zero trust is going to continue from the standpoint of I don't trust anybody that walks through the door, whether they're an employee or a vendor. And I think that's going to be a much longer tail than it should be, but that's the transition I think we're going to be making.
I agree. Just briefly, any closing thoughts that you really want people to walk away with from our conversation?
I think, again, the most important thing is making sure that you're listening to your InfoSec cyber people. Unfortunately, as it stands today, is that it's viewed as a big cost center in a lot of situations, and you can't tie a revenue line to it. And understanding the connection between your cybersecurity InfoSec costs of doing business and and other lines of business that you can tie revenue to is real important. And again, most mature organizations understand it and from a topical standpoint, but the education and continued education of both staff, leadership, and providers, it's just never going to stop. And I think those are probably the most important things that come to mind.
Yeah, very, very important points. Well, we appreciate it so much, Ron. Thank you so much for your wisdom today. And it's always great to connect with you. You always have important things to share with us. So thank you very much.
Thank you. I appreciate the time.
Absolutely. And thank you to you and our audience for tuning in. This concludes this session. Have a great day.